The infection control service is a key element. It's one of the few services that spans across the whole hospital, from the clinical areas to the non-clinical areas, housekeeping, hygiene through food standards. So it's a key role, and it's one of these things that you don't know what's going on until something like an outbreak, like the pandemic. As the pandemic unfolded, it became apparent that things would have to change, and that change was almost daily. Guidance was changing daily. We were linked into the Four Nations down south. Public Health disbanded midway through the pandemic as well. And the information that we needed just wasn't coming out quick enough to meet the questions that we're receiving operationally. And I think, again, we were learning, and we were very quickly having to get up to speed to then confidently and credibly pass this information on to others.
Well, I mean, it obviously had an impact on the service. It was kind of, everybody, I suppose, was worried and scared a bit. You know, coming into a healthcare setting, concerned for themselves, their families at home, and obviously still wanting to do their job. And obviously nobody really knew what COVID was, and guidance was changing all the time. So as soon as infection control got any updates, we were told what the updates were.
We were getting it sent out, quickly having to look over it, and then, you know, disseminate it to all the other members of staff in the hospital. So we were all anxious, but trying to reassure that, you know, if we do this, hopefully, you know, we will keep ourselves safe and keep our patients safe.
We had shielding, and particularly allowing my housekeeping department, because I've got that under my remit as well. Very quickly we lost 25% of our manpower to COVID shielding, at the same time where the guidance was to clean everything twice as much as we did before.
There was definitely a wee bit of fear about the department, which I think was probably the biggest challenge for me, was kind of managing people and just talking to people, make sure they were all right and stuff like that. But I think they sailed through it, to be honest. What was asked for people to come into the work every day, what they're seeing in the news, the scary kind of thing about it, and people were willing to help out, come in, work days off, stuff like that. I mean, every single porter and housekeeper, they were all brilliant for it.
Tissue viability manages wound management within the hospital, pressure ulcer prevention and treatment, and to provide patient-centred effective care for all wounds and skin issues. Well, we actually sit under the infection control manager, so we sit under that umbrella, and we feed in if there was infections and things like that, but we actually sit under the structure of the infection control manager. So from our point of view, the biggest impact to us was the face-to-face tissue viability clinic, because obviously we couldn't hold that no longer because of COVID lockdown. And what that was set up originally to standardise post-discharge care for patients discharged with complex wounds. So they would routinely come into the tissue viability clinic, receive specialist input, and that would open the network for primary care support as well as the patient, so that the patient's not lost once they're discharged. So our struggle was we were still getting complex wounds, but it was what we were to do with them once they were discharged. So one facility that we did undertake was the Near Me virtual facility, to see if that could allow us to still have interaction with the patients, but see their wounds virtually from their own home or a treatment centre at the GP surgery. What we found through using Near Me, it's actually strengthened some of our communication with primary care, so the interaction with district nurses, because obviously supporting them through something that was new, and then signal failures, Wi-Fi issues, you know, when they're in the patient's home, as well as then it also strengthened allowing the consultants into the whole discussion, because obviously reassuring them that your patients, you know, will be followed up. So it strengthened relations there as well, and broadened through difficult circumstances. It's actually broadened how well we work with each other.
I think the biggest challenge is now how we get back to what infection control was before. So I think for us, while there's a remobilisation plan for NHS Scotland, there's also the fact that infection control teams need to get back to what was clear standard infection control guidance and not pandemic guidance. We lost a member of staff during the COVID pandemic, and the individual was pretty honest and just said they felt that the reliance on them to give advice and the stress of the last 9 months, they just felt the role wasn't for them personally. So we went out to advert and we got a new recruit, Hannah, who joined us from Glasgow Royal Infirmary, brand new to infection control, had dipped her toe in the water a wee bit with some of the sort of link nurse stuff in her old role, but not anything like what we had going on at the time.
Before I came here, I was a staff nurse in a respiratory ward in another health board. So I come here to a new health board, a brand new role in a post that's a promotion for me. So I'm having to learn how the organisation works, what an infection control nurse's role is as well, but also dealing with a pandemic. So as you know, I know I'm getting to grips now with the pandemic infection control role, but I have very little knowledge of what the role is in normal times when we're not in a pandemic.
We're now at the stage where we're having to let Hannah relearn what infection control, what our business is, because she joined at a time where surveillance had stopped. The theatres were taking on different specialties. So all of that now, we're having to obviously maybe even retrain Hannah once we're starting to come out of COVID, but she's absolutely stepped up. She's a joy to work with. The team have really enjoyed having her on board.
When the clinical waste contract ceased one day in December 2019, all the boards obviously had to try and find a way to deal with all the clinical waste, and the porters obviously here took that all on board themselves and all again pulled together as a team, all worked.
Me and Lynn Moffat got all the porters together and we spoke about the situation, and there was no bins anymore, so but all the porters were amazing, signed up for it straight away, gave their time, which right then it was only meant to be for 4 months kind of thing. So that was their kind of, we'll do it, we'll do the overtime, we'll do the 12-hour shifts, we'll pick up the bags. They were dealing hands-on with all the clinical waste that comes out of here. So, and then it obviously went on and it still goes on to the day, so it's 2.5 years nearly. And it's still the same group of guys, 6, 7 or 8 of them, still doing it all this time later, which is amazing for a group of people to give up all their time and kind of focus. But it just shows you the spirit, I think, in the department.
We had the recovery process happening, obviously the theatres all back up running again, the eye centre opening in phase 1, so we had all these things still going on in the middle of a pandemic. So yeah, I won't say it's not been hard, it has, but I think just all pulled together.
From the team's perspective, I think it demonstrated our resilience. I'm not going to lie and say that every day we were all buoyant, but there were certainly times in the day where some of us were more buoyant than others. The team have got a good work ethic for a bit of joy in the workplace, and we always made sure that at some point in the day we sat and had a 5 or 10 minute chance to check in, a cup of coffee, talk about TV, because at that point in lockdown that's all people were doing anyway. But certainly I've been amazed by my team's resilience, and I'm grateful to them for seeing it through. As NHS Scotland are recovering, and the Golden Jubilee has been one of the key organisations to support that recovery. New specialties coming on to the site, so that means a review of standard operating procedures, and every single operational SOP requested the infection control team's input to ensure that it captured all the guidance and was aligned with the national guidance. Quite a task in hand really, again, considering we're a really small team. And at the same time we had commissioned the opening of phase 1, and we were starting to do the commissioning for phase 2 and the phase 2 rebuild. And interestingly enough, we have recruited into another post. We had another post to support theatres, but the girl that's got the post was here before, and she said she can't believe what's changed within the organisation despite the pandemic. And I think for Sandra and I, we tend not to look back, we just keep going. And it's a fresh pair of eyes actually highlights that in 1 year, when the whole world's in a pandemic, the hospital and my team had helped make so many sustainable changes and still managed to keep the site COVID light. We hadn't thought about it that before, and it was nice for my team to hear that from someone else that was coming back.
You feel like the hospitals maybe got smaller. I don't know that sense. Like, I think you were just talking to the nurses and that a lot more. This hospital's always been good that way, that you've got on with other nurses, you know them all personally, you talk to them, you know their names and stuff like that. That goes right through the department. But I feel like this, it was just everybody was in the same boat, and I think it was amazing to see that everybody's objective, even though people were feeling a bit unsafe and some people were a bit fearful of what was going on in the world. Everybody's objective was the patients, which it should be, and it has always been, but this just brought it more to light, I think.